Hello everyone, I'm Yash and this is my Iceland final presentation. So first I want to start with a quote that I read and I really like what it said. It says, "Determined never to be idle, no person will have occasion to complain of the want of time who never loses any. It is wonderful how much may be done if we are always doing." And Thomas Jefferson said this. I really like this quote because it talks about how the time is now and you should make sure to work hard and try to not say push things up to tomorrow, and it's really important to not procrastinate and then not later on complain about not having enough time. So a little bit about me. I'm a junior here at Frisco High School, and I have an interest in medicine and a physician later on. Some of my hobbies are I like playing golf, working out. I'm in ISM, and my topic is surgery, and I'm actively pursuing a pre-med pathway later on to go to medical school and be a physician. So first, I'm going to talk about my initial research focus on my topic, which was surgery. I didn't, since there's so much spread out for surgery, I kind of saw a plethora of different articles and different topics. There were surgical procedures, how different doctors and different surgeons manage a patient's whole care in the surgery. Um, it also talked about different procedures that surgeons can do or different ways that surgeons help patients and make sure to optimize their recovery time. There were also different approaches and methods that new surgeons were trying to incorporate that would, like again I said, help lower recovery time and eventually just make the patients feel more comfortable. Things like bone glue in orthopedic surgeries, which I observed, which was a big part, talked about using instead of an older glue used back from 1970, they created a new compound that could help reduce the patient's joint pain and flexibility. There was also efficiency in ORs. That was a really big topic because obviously the goal of a surgeon is to save as many lives as possible, fix the problems. So there were many trying to how can we fit in this many surgeries, but at the same time not lower the standard of care. And handovers in surgery, which was a newer topic that I saw, was patients might operate. Patients might have be multiple patients might be operating under one surgeon, and they would have, for example, residents operating in simple procedures, and the surgeon would overview. And obviously, this is very complex because you don't want to make errors, but at the same time, it can also optimize the patient's time, the surgeon's time, and the resident's time. So yeah, observations from this, I saw that every surgery, there's so many things that go around with it. There are many variables, and it's very methodical and standardized because obviously this happens every day, and there's multiple operations running in. Maybe you could say 10 operating rooms. There could be operations happening, maybe 20, 30 operations a day. So it's really making sure that the planning around that and everything is organized to make sure nothing is skipped, because as a patient, you don't want to come to the hospital and just have your surgery skipped over as the surgeon wasn't ready because they ran long with another. Everything should be organized, and there should always be a backup plan. Going into efficiency and outcomes, being very efficient because the surgeon wants to save as many lives, right? So the patients would come in at a certain time. They'd get checked when the surgeon's ready. Maybe the surgeon would go and finish another procedure, and then they would get ready. The patient would go into pre-op and get ready. So this efficiency is really important. Keeping this timing and this proper timing can help save many lives and increase the proper outcomes that the surgeon has. I saw a lot of communication between patients and surgeons. In my own experience, actually, I saw that the surgeon, since they're trying to handle so many things and manage so many different procedures, they're actually not having much time to communicate with the patient. It's more like you might communicate with the nurse or whoever's pre-oping you, like an anesthesiologist, more than your surgeon, which I thought there was a gap in that, and patients should be able to have more time to speak with their surgeon so they can actually understand what's happening and avoid that fear of, okay, I'm having surgery, what's happening? And that's a very common fear that I saw in an article. It talked about how almost 40% of patients who haven't had surgery before are really scared of it, and sometimes even don't do the procedures even if they need it and it's life threatening. So this communication gap, it, um, it made me switch from just overall surgery and all these different variables into specifically patient comprehension. So current methods for explaining a complex procedure, surgeons obviously don't think about how can I, because in their rush they don't think about how they can optimize like making sure the patient understands. They kind of just give the same rundown to each patient and just say this is what you'll expect, and I'll see you in the operating room. That's really it. And sometimes this works for some people, but for a first time patient who's never had surgery, or someone in like a tense situation that's like just had a quick surgery that had to come up, they might be more worried, and this could create more stress and anxiety overall. So I researched like informed consent, like before a patient has to go into surgery, they have to sign a consent form that says anything that happens under the list of like complications was not, they can't like sue the surgeon if it's under the list of complications. And patient comprehension studies, so different surveys and articles talking about how um, patients, like how much did they actually understand from what their surgeon talked about, how much did they actually understand what happened in the procedure, or did they just like let it happen and they didn't really know what was happening. And this kind of created the main question that I wanted to focus my research about was, does explanation truly equal understanding? So if a surgeon is explaining something to a patient, do they actually understand, or are they just saying that because they think they have to say yes and it's like a critical time? So more on the communication gap, I kind of looked at different methods at how can a surgeon, while making sure they're efficient and keeping the same outcomes, how can they make sure to explain and help the patient understand more for someone who doesn't have as much medical knowledge as like a physician. So limited visualization. So surgeons obviously don't have any charts or anything. Sometimes they might draw something for a patient. In my experience, they drew what was going to happen in the joint, but it's really like small. It doesn't fully explain what's happening, and it's kind of just like, okay, I kind of understand that, but there's not too much time to answer questions. Even if they, as I was saying, there are diagrams, they might bring in a diagram of like an X-ray or something of their own X-ray, and they would explain it, but that doesn't really help someone with low medical understanding really understand what's happening. And as at the end of all this, this increases anxiety a lot and makes the patient more worried, which just does not help the situation. So this is an example of when I was looking at one research article. So these are of the same people for a scoliosis surgery. So on the right is just a normal X-ray that a surgeon might show the patient of their spine is like curved and it's not straight and normal. And this would be the after result of the new rods and bolts put in that put the spine straight. But it's kind of hard to understand, and in maybe a period of 5 minutes, the surgeon would explain a few things, and then that's it. So there wouldn't be much time to explain. But on the left side, it shows the before result. Then it shows how they like where they're going to insert from the side, what they're going to do to the spine, and obviously there's more examples like this. But it shows how having something 3D can help people understand more, especially with lower medical knowledge, and in such a short period of time, it helps them understand like what is actually going to happen. And they can start imagining it themselves, which lowers anxiety and stress. So my first prototype, which was my like original work, was called Surgical Explorer 3D. It's basically a interactive, like intuitive website or app that can that a patient can view and they can see their procedure. So it explores like the human body. So my goal was to have like some type of body or something that they could like click on and see. Okay, this is going to happen here. They're going to insert the knife here. They're going to insert this here, and this is actually what's going to change at the end. There would be surgical walkthroughs, like I said, visual guides. So, like putting an emphasis on having visual, not just too much words, because in a time of like short time and stress, it's hard to just read a paragraph or maybe an essay of just what's happening. It's just hard for patients who don't have much medical knowledge to understand. And patient-friendly language, because obviously doctors know their language. So when they're saying it to a patient, they might not fully simple it and like dumb it down for the patient to understand. But this would have something that the patients could easily understand and not have to like get confused or fret over. And yeah, as I was saying, enhanced comprehension, because it shouldn't be like an essay that they don't understand. Like, I don't really understand what's happening here. It should be something that can like alleviate the stress and anxiety, and at the end of the day, not have any confusion into what's happening. So this was just like my prototype, which was like my original work. It was like a really basic, not a full model, but it had all the body parts, head, neck, chest, and if you click that, it would show the surgery you were doing that was happening, and it have for example, it have the simple explanation of the surgery, some steps that would happen, recovery time, and risk. But it was all fact checked and verified. But as you can see, there's not much interface here. It's kind of just basic and not fully easy to maneuver. So some challenge. Oh, sorry. So I took some guidance from physicians based off of what I after I showed them. I had three interviews. The main one I had was with Dr. Vichin where he really understood that topic because his field of surgery is transplant surgery. He talked about how patients that he's seen often feel really stressed and are almost like grabbing him to keep him in the room and keep asking questions. And when I saw that when I went and visited the hospital, I saw that yeah that they're really sometimes they're really stressed out and nervous. Often in like older patients or even really young patients, their parents or family members would be really nervous for what's happening. So he told me that the most important thing is you want to have easy. It should be easy to maneuver, easy to like access, and so the patient can understand even in like a stressful time. So usability was like one of the main focuses when I was starting to work on my final product. I wanted to make sure it was really easy to maneuver. Everything was labeled. They didn't have any confusion because there's already so much stress and tension going around. It should be easy for them to move, for them to understand. So more on my he's I asked him to be my mentor because I thought for him, especially in his field of surgery, transplant surgery, which is one of the most high stress surgeries. Obviously, you're taking transplant surgery. Basically, you're taking a foreign organ and basically putting it into a patient and helping them, and this would replace their old organ and get their function back. So very stressful surgery, and he basically told me 3D model, make sure it's actually a real person, which I was trying to implement at the time. Make sure that they can like because they should be able to relate to it. They should be able to understand what's actually happening. Proper labeling and visualization. Before there wasn't much labeling. It was kind of just like you click this, it'll show you like a long paragraph, but it doesn't really explain fully what's happening. There wasn't a feature where you could ask what's happening. It was kind of just here it's just some data, some paragraph that's put together, and what more can like I add to it. And he said make sure it's very accurate because obviously misinformation and spreading of misinformation is a very common thing, especially in the medical world. People might post something on like a Reddit chain, and it would be this happened to me during my procedure. Watch out if you're having this procedure, and this would pop up the first thing you search up. And this is actually really dangerous because whatever happened at that one instance to this one person most likely will not happen again. That hospital could use different procedures, they could use different methods, so you don't want to rely and trust that, and that just again makes you more confused and more stressed. So I wanted to turn all this feedback that I got into more action for my final product. So as you'll see on the next slide, I made a refined interface so everything was easily like accessible. There were new features added. The procedures I made sure to obviously have the right information and make sure there's no misinformation spread. But at the same time, I wanted it to have enough that you could actually understand instead of it's just like, oh, a transplant, they're just putting one in and taking another. But it still explain what's happening, but at the same time have the right data so that it's not spreading misinformation. Visualization, I made sure to add a actual 3D body that shows like specifically where each organ is, so where it would be happening, and this just helps the patient actually imagine like what's going to happen, so which will eventually reduce their stress. And I made sure that it should be able to be simple and easy to understand. That was the main goal. So this is my final product. I'm still working on a few things, and this is just to explore the body area. But as you can see, it's clicked on the knee. So this is just a joint. Then it has a small description of a knee replacement surgery. You'd have your steps. So simple steps. Obviously, a surgeon knows way more, and there would be more steps here. But this is kind of just simple main things what will happen. Then another important thing is recovery time. Recovery time for patients is often like a high stress factor. In an article I read from the NIH, they said that patients often worry more about how can they accommodate what's going to happen after the surgery versus the actual surgery itself. So I made sure to put what recovery is needed, like physical therapy, or you'll have to make sure to not move after this for this amount of time, or you might need someone else to help you. So all of this will just like lower the anxiety and lower the confusion. And then it adds risks that are also like verified. There's no misinformation because misinformation you can see like death, and then people might get really worried, seeing oh my god, death. Can I even do this surgery? Is it too risky? What's going to happen? But they don't show the percentage of that. They don't show how often that can actually happen. And I added some other features too, not just to explore the body. There's just your general procedures tab. So if you're trying to see maybe if I have this problem with my knee, I can see two different types of procedures that could help the situation. Then questions. So that's a new feature I just recently added. It talks about how if you click a procedure, say you're having a knee replacement, you don't want all your information to come from this. You still want to talk with your surgeon and have them explain what's going to happen. So that the questions tab adds, it'll give you questions to actually ask your surgeon, and you can pick maybe 2 to 3 that help you fully understand what's happening that is not explained here. And then another last thing is Ask AI. It can help you. Obviously, it's not a medical professional, so you don't want to fully take the information, but it's just a good like starter or something for you to understand the basics of the procedure that the surgeon already knows and might not explain. So, in conclusion, I wanted to emphasize real patient understanding. That was my goal here, to make sure that the patient can actually understand what's happening in their procedure. They can feel comfortable about it and have no stress. Demystifying surgery, because surgery is often like a really scary thing, really nervous, and that this should not be happening. So 3D visualization, that's one thing I made sure to add, 3D visualization, because it helps patients actually imagine what's going to happen and help them feel more comfortable. And then there's still more to add on my final product. I wanted to make sure it's still easy to analyze and not have any like mishaps happening in the website. But yeah, thank you for listening. Any questions?
You guys have questions?
Suggestions.